We'll start with next chapter. agnikarma1504 व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः क्षारादग्निर्गर्यान् क्रियासु व्याख्यातः तद्दग्धानां रोगाणाम् अपुनर्भवात् भेषजशस्त्रक्षारैः असाध्यानां तत्साध्यत्वाच्च. Now, the kshara, the Agni is considered to be more superior to kshara in relation to the factors like it can result in a complete removal of the lesion, and it can have a better scope, or rather more wider scope than the Shastra Kshara as such. So it's not an issue of controversy, because in the Kshara chapter, Sushruta has said that Kshara is the Shrestha, and in the Agni Karma chapter, the Agni is considered to be Shrestha, but this is not a controversy. It's depending upon the areas or the scope as such. The Agni Karma has a scope of a complete removal, non-recurrence of the lesion. Now, the very other interesting aspect in the history of humanity is Agni, or the fire, is considered one of the Panchamahabhuta, one of the factors which is necessary for the creation. And it is considered, it was worshipped as such. And from the Indian history point of view, the Agni is considered as a superior one, and the control of or regulation of the Agni to make use of for the benefit of the humanity is a major, the most important invention. More than any of the invention, Agni, which is supposed to destroy everything, and getting control, having over that, and making use of that Agni for the benefit of the human being, in terms of the Garhapatya, that's the cooking, preparing the food. So in Manusmriti, the Agni is classified as Garhapatya and Dakshinagni and Ahavaniyagni. The Garhapatya Agni is the domestic fire which is used for cooking and preparation. Dakshinagni for the burning of the corpse, so that it can just burn this living being, or maybe the beings as such. Ahavaniya is for the worship. So this kind of classification, a gradual change in the approach to the Agni, is seen in the history of humanity, and use of the Agni for the benefit of or for the management of the disease is a very major breakthrough. And in Rigveda, Agni Sukta says, Yadangam dashishetvam badrem karishyami tavetat satyam angiraha. The Agni, when it touches any part of the body, when it comes into contact with the body, that part of the body would be cured, or rather it will become better. It improves the function of the particular body. This is what Agni Sukta says. So this evolution of the inventions, starting from the worshipping of the Agni, or maybe Agni being one of the fundamental constituents of the creation, and to a level where it is regulated, controlled, and used for the treatment of the disease, is a major breakthrough. Now, anyway, from the text, Sushruta's text point of view, the instruments used for the producing the Agni karma are atha imani dhana upakarnani bhavanti tadyatha pippali ajashakrita godanta sharasharaka jambavostra idarloha shautra guda snehaha. तत्र पिप्पली अजाशकृत गोधन्त शरशलाकाः त्वग्गतानां जाम्बोष्ट इतरलोहाः मांसगतानां क्षौद्रगुणस्नेहः शिरास्नायुसन्धिस्थिगतानां. The materials used for Agni karma are either dried pippali, or the dung of goats, dried dung goats, or teeth of cow, again dead cow, and then metallic instruments like shara and the sharaka jambavasta. These are the metallic instruments. Shara is a arrow where the tip is pointed. Sharaka where the tip is somewhat wider. Jambavasta where it would have a mass of metal. Now these, and then are itarloha, other metallic instruments. Then Shaudra Guda Sneha, liquid substances like honey or jaggery, or maybe the oil. Now this selection of the material would be depending upon a basic principle of the physics, that's the specific heat capacity. Specific heat capacity of a substance is the amount of the heat required to raise the temperature of that substance by 1 unit, and this also is a capacity of that substance to transfer the heat. Now, this will be varying from material to material. Wood has comparatively lesser specific heat compared to the others. So the different specific heat of the materials which are now in use, they are here. Of course, water has the maximum specific heat, in the sense once the water that liquid is heated, the it can retain the heat for a longer duration. It can transfer the heat for to a higher extent as such. Now the same concept is used in the selection of these materials. Typically being having a lesser mass and having a lesser density of the material, it has, compared to all these list of the materials, it has the least of the specific heat capacity, and hence it can be used for only superficial burns. Then gradually there is an increase in that specific heat capacity. Ajasakra, the dried dung of a goat, then the teeth of the cow, and metallic instruments. These would have gradually increase in the specific heat capacity. Even in the metallic instruments, the mass of that metallic instrument could be modified by modifying its shape, like shara, shalaka, or even jambostam. So this, by that you can have a increased specific heat capacity, and a higher penetration can be possible. All liquid substances which are heated, they would have a higher penetration capacity, and the specific heat capacity also is higher, and hence when it's for the deep burns like Silasnaya's and the deeper burns, it's the liquid materials which are used. So a basic principle of physics is involved in that selection of the materials. तत्र अग्निकर्म सर्वोषु कुर्यात् अन्यत्र शरद ग्रीष्माभ्यां तत्रापि आप्यैके अग्निकर्म साक्ष्ये व्याधौ तत्प्रत्यनीकं विधिं कृत्वा. The agnikarma is contraindicated in hot seasons like Sharad Rutu and Grishma Rutu. But if it's an emergency, if there is a specific indication for the agnikarma, then it can be done by taking care of the other issues. Supportive measures have to be taken, and then the agnikarma can be done. सर्वव्याधिषु ऋतुषु पिच्चिलम् अन्नं भुक्तवतः मूढगर्भ अश्मनि भगन्त रोगेषु मुखरोगेषु अभुक्तवत कर्म कुर्वीत. Now, in all the other seasons, before the agnikarma, patient has to be given a slimy food, except in case of Mudagarbha Ashmari Bhagandara. Now, Mudagarbha Ashmari Bhagandara Shomukha Roga, these are the conditions where whenever you handle this gastrointestinal tract, it should be preferably kept empty. That's the issue which we have already discussed in the context of the Purvakarma. तत्र द्विविधम् अग्निकर्म आहुरेके त्वग्दग्धं मांसदग्धं च शिरास्नायुसन्धिस्थितिष्वपि न प्रतिषिद्धो अग्निः. Primarily, the agnikarma is of two categories: त्वग्दग्ध, मांसदग्ध. त्वग्दग्ध is a superficial, मांसदग्ध for the deeper burns, and शिरास्नायुसन्धिः is still deeper. In Sushruta's time, the first two were more popular, whereas the deep burns involving the tendons, ligaments, and joints, they were not that popular. Now, once you do the agnikarma, the signs of the proper agnikarma would be depending upon the level of the burn to decide like whether you have achieved that swagdagda or the mamsadagda. Would be shabda pradurbhavaha durgandata toksankochasya twagdagdhe. When the burn is done, produced over the surface of the skin, surface of the body, or pucker, then there will be some sound produced due to release of the humidity, and there will be a smell, very typical smell of the burning of the keratin tissue, and toksankojaha, there could be contractions of the skin. Whereas when the burn is in the mamsadagda, the deeper level, like the adipose tissue, which has crossed the fascia of the skin, then kapota varnata alpashvet vedana shushka sankuchita varnata ja mamsadagdhe. Now, once it is mamsadagda, then it will be having a grayish color, kapota varna, the color of the kapota bird. Now, they are alpashvetu vedana. Comparatively, the swelling would be lesser. When the deeper tissue is involved, the pain and the swelling would be lesser, because sensitivity, sensory nerve endings there would be lesser. Then shushka sankuchita vranata, the wound will be contracted due to the contraction of the fibers. That's the sign of a mamsadagda. In Sirasnaya, when it involves the vessels or muscles, deeper one, Krishna Unnara Pranata, there will be dark black color due to destruction of that blood components and oxidization of the blood components. And Sravasanirodashta, there will be hemostasis, or rather clotting. There will be no discharge as such. Ruksha Arunata Karkasha Stiranata Sandhya, when it involves the deepest levels like Sandhya and Asti, the wound will be having rough surface and the dryness is characteristically seen. Tongmansa Sirasmaya Sandhyastice articularity Vayo Uchrita Katina Suttamamse Vrane Granthi Arsho Arbuda Bhagandara Apati Shripada Charmakila Tilakalaka Antravruddhi Sandhi Sirat Chedanadishu Nadi Shonita Ati Pravrutishu Agni Karma Kuryata. The indications for the Agni Karma are quite important. One set of the indications are the localized diseases of superficial one, like Granthi, Arsho, Arbuda, Bhagandara, Apachi, etc., Charmakila, Tilakaraka, as such. These are one set of the conditions where Agni Karma is done as an alternative to the surgical excision. The tissue has to be excised. Antravruddhi, in case of inguinal hernia, or of course, in case of even there is another specific indication in case of Mutraksharana, in the context of Ashmani surgery, Sushruta mentions about that indication, whereas in this list it's not mentioned. A Mutraksharana Brana, where there is a leakage of urine through the incision of the bladder. In these conditions, Agni Karma is done to close an aperture, like in case of Antravruddhi, the inguinal opening, which has resulted in that abnormal protrusion. That inguinal opening could be closed by inducing the fibrosis. So, idea of inducing the fibrosis by Agni Karma, or even case of Mutraksharana Vrana, where there is a wound in the bladder and that bladder wound has to be closed up, and to induce the fibrosis, Agni Karma is done. Or the Agni Karma also is done to reduce the bleeding or as a hemostatic measure. Nadi Shonita Ati Pravarti, in case of Ati Pravarti of blood, the hemostasis, to produce a coagulation of the blood vessel, it's done. In addition to this, another specific indication for the Agni Karma is Vayo Uchita Katina Suttamamse Vrane. In case of Vata Prakopa, producing the pain, any of those painful conditions which could be involved in Sirasnaya Sandhi, etc., and even a Vataja Vyadhi. Now, this is a very interesting issue. Agni Karma is done in almost in every system of medicine. Now, of course, we do the cautery. Cautery is an alternative, or rather a development of the Agni Karma. And the indications for the cautery now are, one is to cut the tissue, as in case of that the localized lesions. For localized lesions, it could be used, or even it can be used for alternate of incision. Another important use of the cautery is to produce coagulation, prevent the bleeding during surgery. It's done. So the indications for the arrest of the bleeding and indication for the excision of the tissue, removal of the tissue, they remain the same as such. Whereas Sushruta had some more of the other additional indications, that inducing the fibrosis with an Agni Karma to close an aperture, as well as use of the Agni Karma for a systemic disorder. Now, in the context of sleep and other conditions, you will come across a Agni Karma being done at the level of the wrist joint for a treatment of the sleep, where the lesion is or maybe even in case of Galaganda, where the lesion is in the neck. So that kind of a remote control treatment, like where the Agni Karma is done on somewhere else, and then the patient would have a relief of lesion somewhere. Or as in case of sciatica, Grudrasi, where it's a painful lesion and the Agni Karma is done somewhere and then it produces relief. This kind of the concepts are not known to the contemporary system of medicine. The contemporary system of medicine uses the cautery for only these two purposes, either destruction of the tissue or to arrest the bleeding. The other two indications are unique idea of Ayurveda as such. Now, whenever the Agni Karma has to be done, the burning at that area, cautery produced, could be of different shapes. Valaya, Bindu, Virekha, Pratisarana, Dahana Visheshaha. Either it could be a circular burn produced. If it is a localized lesion where you need to excise a tissue or bindu, just a dot of burn. If it is a lesion like a small part as such, only that area has to be burned. Vileka, a line where if at all you have to open access or open access, get access to the deeper area, then Vileka. Pratisarana is a patch of burn. That patch of burn is again a unique idea of Ayurveda. In the present day situation, of course, with the cautery, we may have Valaya Bindu Vilekha or any of that shapes, depending upon the region. But having a patch of burning is not a regular practice in the contemporary system. भवन्ति जाता रोगस्य संस्थानमवेक्ष्य सम्यक् नरस्य मर्माणि बलाबलं च व्याधिं तथा ऋतुं च समीक्ष्य सम्यक् ततो व्यवस्थेत भिषक् अग्निकर्म. Now, the agnikarma, before you do the agnikarma, you have to be careful considering the location of the lesion, the plane of the lesion, and then the anatomical importance of that part of the body, the physical strength of the patient, as well as the status of the disease. Considering all these, agnikarma has to be done very carefully. That's what Sushruta warns. Now, once the agnikarma is done, you will have a wound, and that wound has to be treated. तत्र सम्यक् दत्ते मधुसर्पिभ्याम् अभ्यङ्गः. You have to have clean that wound and then apply madhusarpi and treat the condition as you treat any of the wound. अथ इमान् अग्निना परिहरेत् पित्तप्रकृतिम् अन्तःशोणितं भिन्नकोष्ठम् अनुद्धतशल्यं दुर्बलं बालं वृद्धं भीरुम् अनेकव्रणपीडितम् अस्वेद्यां स्येति. The contraindications for the agnikarma are patients with the pitta prakriti, where the patient has a bleeding, a concealed bleeding. Antashonita is a concealed bleeding, or patient who has a ruptured abdominal contents or perforated abdominal conditions, or if there is already a hidden shalya and that shalya is not removed, you are not supposed to cauterize the wound, because once you have cauterized the wound will be closed, and the whatever that irritant substance, foreign body, which is present in that area may remain, and it can result in sepsis and durbalam balam vruddham. So if the physical condition doesn't permit, then it should not be done. Or aneka vrana piritam, if the general condition of the patient is not allowing or is not stable, where there could be multiple lesions in the body, agnikarma is not done, and astvedhyam steti, all the contraindications for the svedana etc. Now, cautery is practiced almost in every native system, almost every native system throughout the world. You get the history of cautery, and even in the contemporary system, cautery is used. So, but the speciality is about the care and the specificity of the procedures of the agnikarma mentioned in Ayurveda, where every step is detailed. Selection of the materials is very unique, so that's the identity. But use of cautery is known in the history of the Western medicines or any other, almost globally, almost every system has description of the cautery. Now, the cautery which was used earlier in all that areas was a direct heat. But in the present day situation, it's the electric cautery which is common. Rather, a direct heat is rarely used. The credit of inventing that electric cautery goes to William T. Bowie, who invented the use of electricity for the sake of producing the cautery. And now you have lots of technologies. The technology has developed and technology has gone to high levels, and you will have very sophisticated tools as such, and the technology has developed very rapidly in the past few years. And in the present day situation, the final, or rather the latest, is the harmonic ones, bipolar and monopolar. See, the cauteries are of two types, bipolar and monopolar. In the bipolar, one pole is placed on the area where you have to produce burn, and the other pole is placed on the patient. In monopolar, the other pole is negative pole is kept on the body of the patient, so the current has to pass through the body. Whereas in the bipolar, both the poles are kept on the same instrument, so that the current doesn't pass through the wider area. So bipolar is somewhat considered to be more safe than the monopolar, and it can be used for cutting or blending, binding the tissues, or for coagulation. And the regulation is you can have a better regulation of the temperature as well as the duration of heat with the current instruments compared to what Sushil had used. Sushil had used that different materials for different burns, whereas or different levels of the burns, whereas now with the instruments of this sort it can be used. And the latest is the harmonic scalpel, where the heat energy as well as a these ultrasound waves, rather vibrations, are produced. So there will be protein coagulation. So these are all the later modifications of the Agni Karma. Still, we can consider them as the modifications of the Agni Karma. That's about the Agni Karma procedure. Now, in the same chapter, Sushruta mentions about the possibilities of a accidental burn and its management. So, Agni Karma is a therapeutic procedure. Now, Itaratha Dagda is the accidental burn, a fire accident producing the deep complications as such. अत ऊर्ध्वम् इतरथा दग्धलक्षणं वक्ष्यामः. तत्र स्निग्धं वृक्षं वा आश्रित्य द्रव्यम् अग्निर्दहति. अग्निसन्तप्तो हि स्नेहः सूक्ष्मशिरास्नायु अनुसारित्वात् त्वगादीन् अनुप्रविश्य आशु दहति. तस्मात् स्नेहदग्धे अधिका रुजा भवति. A burn, an accidental burn, could be due to either a liquid material or could be solid material. When the burn is produced due to liquid material, the heat penetrates deeper. Now, it's the same issue in case of therapeutic burn too. Accidentally also, when the heat is produced due to liquid, then the penetration is deeper, and hence the complications of a liquid burn is more than a burn produced due to a solid substance. This is a common experience. Any liquid, heated liquid falling over the body, it can produce the complications as such. Now, depending upon the level of the burn injuries are classified as Tatra Plustam, Durdagdam, Samyak Dagdam, Atidagdam Keti, Chaturvidham Agni Dagdam, depending upon the level of the burn, depth of the burn, and the complications. They are categorized into 4 categories. They are Prusta, Durdagda, Samyak Dagda, Atidagda. Now, in this context, there is another issue that word Samyak Dagda should not be confused. Samyak Dagda used in the context of therapeutic burn suggests about the optimum burn conditions produced depending upon the level of the burn you want. Like in the Tvak, you will have Shabda Pradurбhava, Tvak Sankocha and Durgandha. Whereas in Mamsa, you will have Kapota Varna and so on. So that Samyak Dagda word is different. Whereas Samyak Dagda used in the context of accidental burn, it suggests about a specific level of the burn where this burn is deeper compared to the deeper than that of the skin, but it doesn't reach to the muscle tissues as such. Now, the clinical signs of these burns, these levels are Tatra Plustam, Yadvivarnam Pushate Atimatram Tat Plustam. When there is only a mild discoloration, hyperemia, but no tissue destruction, that's the Pustadagda. So, just very superficial temporary burn, there is no permanent damage to the tissue, only there is an irritation, and hence there is an increased vascularity, which occurs quite frequently. Now, you will come across this kind of Pustadagda very regularly in all domestic practices. Like many of the domestic activities, you will have just you touch some heated substance and then you may have a burning sensation for a few minutes or maybe a few short duration, and locally there could be a hyperemia. That's the Plussadagda. Yatra uttistanti spotaha tivraha choshadaha ragapata vedanaha chiratyapashamyanti tad durdagdam. Durdagda is when the level is deeper and then there will be blebs formed. Now, whenever a bleb is formed in a burn, that means the burn has reached to the subcutaneous plane. The keratin tissue and the skin, in between the skin and the subcutaneous tissue, when there is a collection of the fluid, that results in the blebs. So, whenever there is a bleb seen in case of a burn, that means the burn has gone beyond the skin deep, or it's also called as a complete skin burn. Now, we categorize now as a partial skin burn or a complete skin burn. Whenever there is a bleb formed, that's suggestive of a complete skin burn. And Samyak Dagdam Anavagadam Talavarnam Susamsitam Puralakshanayuktam ja. When it's a Samyak Dagda, you will have the features of that complete skin burn. In addition to that, you will have a Talavarna, a grayish color, deep grayish color, and the wound is somewhat deeper, and that suggests you a level where the adipose tissue is burnt and the muscle tissue also is seen, where the skin and the adipose tissue is burnt as a deeper fascia also is burnt, and hence the deeper tissues are visible. That's the Samyak Datta. So Samyak Datta in case of accidental burn suggests about a level of burn where the adipose tissue is also is burned and then the muscle tissue is visible. In the current classification, we don't have a separate category of that kind of a classification. अतिदग्धे मांसावलंबनम गात्र विश्लेषः शिरास्नायु संध्यस्ति व्यापादनम अतिमात्रं ज्वरदाह पिपासा मूर्छाश्च उपद्रवाः भवन्ति व्रणश्च चिरेण रोहति रूढश्च विवरणो भवति. In the atidagdha, it's still deeper burn where there will be destruction of the tissues and there will be free hanging of the tissues, fibrous tissue like muscle and fascia. They could be seen hanging over the area, and even there could be damage to the vascular structures, sira, or the snayu sandhyasti, even the bone also could be affected, and hence it results in more serious or severe clinical systemic signs like jwaradaha pipasa. Septic complications will be higher, and that wound will heal, take more time to heal, and even if it heals, it will become discolored or contractures could occur. तदेतत् चतुर्विधम् अग्निदग्धलक्षणम् आत्मकर्मप्रसादकं भवति. This kind of an assessment of the four categories is necessary to plan the treatment. In the contemporary classification, we usually classify these as the first, second, third, and fourth degree. The first degree burn is where it's only the skin has just an inflammation, same as Pristadagda, where there is a hyperemia. Second degree is deeper, where you will have the blistering, that burn, and blistering is produced due to collection of the fluid between the surface of the skin and the deeper fascia. So where the burn has not reached the deep fascia, you will have. And the third degree is the Samyak Datta Lakshana, where there is the muscle tissue is exposed as such. And the fourth degree is where there is a severe destruction of the tissue and goes deeper. So the classification of the burn as we follow now and what Sushila has mentioned is exactly similar. There is a copyright issue. Sushila has described about these stages of the burn thousands of years ago, whereas now it's followed in the same manner. In addition to this assessment of the depth of the burn, in the contemporary practice, there is another issue of assessing the surface area of the burn. And this is important to plan the management, because in all the burn management, one of the important part is administration of the fluid or replacement of the fluid. The major issue is the fluid loss, and the fluid loss is always proportionate to the area of the burn issue, surface area of the burn as such. And to calculate that surface area and to decide about how much of the fluid has to be given in a patient of burn, we use very popularly is the Parkland formula, which is used. And the rule of 9 also is the other way. Rule of 9 is the body is divided into 9 areas, zones of 9% each, and 11 zones of 9% each, and then the genitals are 1%. So this is how head and neck is 9%, upper limb 9% each, and then the 36% for the trunk as such, 9 into 4, that's again 9 into 4, and lower limbs 18% each, that's 9 into 2, and genitalia 1. So this way you calculate the surface area, and that surface area is important to decide about the total quantity of the fluid required in the patient as such. And the fluid will be calculated by the, for every percentage of burn, 4 milliliter multiplied by patient's body weight, that would be the calculated amount of the total requirement of the fluid in that patient for 24 hours. And when you give the fluid again, 50% of the calculated volume has to be given in first 8 hours, and the 50% in the next 16 hours. So the rate has to be decided as such. So surface area is a important issue in deciding about the fluid requirement in a case of burn. If your burn is less than 9%, then there is no need of IV fluid replacement. When it is more than 9%, you will have to calculate the amount, and then IV fluid has to be administered. And this is one of the important essential first aid in case of the burn is to replace the fluid. And that again, the fluid again, in if the burn is more than 30%, it has to be essentially colloid and electrolytes combination. Otherwise, if it is less than that, colloids may not be necessary. But whenever there is a need of colloids, the colloids have to be given in the ratio of 0.5 ml into kg body weight, electrolytes in the ratio of 1.5 ml into kg body weight, and plain glucose is around 2 liters given as a further compensation of the insensible loss. So that's about the Parkland formula, which is quite practically used in case of the management of the burns. So in the management of the burns, there are two components. One major important part is about the fluid replacement. The next is the management of the wound. Management of the wound, of course, it is the same as you treat any of the wounds as such. Now, from the Sushrutas point of view, the management of a burn wound would be based upon the concept of Agnina kopitam raktam brusham jantoha prakupete tatasteneva vegena pittam asya abhyuduyate तव्यवीर्ये उभयक्षेत्रे रसतो द्रव्यतोस्तर तेनास्य वेदनास्तीव्राः प्रकृत्याच व्यर्ह्यते स्फोटाः शीघ्रं प्रजायन्ते ज्वरतृष्णा च बाधते. In case of the burn, it is the rakta and the pitta which get vitiated, and hence you will have to have rakta prasadaka and pitta hara chikitsa treatment has to be done, and the risks are higher because the pitta itself would be a fast changing scenario, creates a fast changing scenario in the clinical condition. The treatment has to be an emergency condition. The general approach to the management is दग्धस्य उपशमार्थाय चिकित्सा संप्रवक्ष्यते प्लुष्टस्य अग्निप्रतपनं कार्यम् उष्णं तथा औषधम्. Now, in case of the Plushtadagda, where there is only a temporary superficial burn and there is no tissue damage, Sushruta suggests is you have to again warm the area so that the patient would have lesser pain. Now, this is a very practical issue. When there is a superficial burn, if you keep that area warm, the management would be that symptom would be lesser. Of course, in all cases of the burns, otherwise, the current concept is every burn it has to be treated with the cold. So whenever there is the current concept would be whenever a burn, immediately you have to pour some cold substance. Of course, the two issues are there. One is prevention of the burn. When a patient is in contact with the substance which produces the burn, that has to be removed. Like if it is a fire, then you'll have to prevent that fire from burning. If it is a liquid or steam and so on, you have to prevent. I will not go into that part. So there is a protocol of dealing with the patient who is in a situation where there is a continuous burn as such. Once that is done, the next part is in the contemporary situation. The approach is you have to cool. Apply certain substances which can cool down. It could be silver nitrate. It could be even ice cubes also can be used, particularly for superficial burn. Current concept is used to use a cooling substance, whereas Sushruta suggests about warming substance. You can have the results, comparative results. When you use a cooling substance, there would be a chance of clotting in the dilated vessels. The dilated vessels become clotted, and hence that area will become blackish in color, and that takes a long time to heal, comparatively 2 to 3 weeks time to heal. Of course, there will be no further destruction. Whereas if the area is kept warm, this is what our traditional household people will do. If there is a burn, and then again they will just warm temporarily, then the vessels do not get clotted and the relief would be earlier. Now, then in all other conditions, it has to be cold treatment. In the deeper burns, Sushruta also suggests about the same, the cold treatment. Sharire sunam bhuviste sunam bhavati shonitam. Prakartya hindakam shitam skandayati atishonitam. Tasmat sukayati husnam nanu shitam katanjana. So the cold application is for only the other burns, not for the Plushtadagda. Now in the Durdagda, Shitam Ushnam te Durdagte Kriyam Kriyat Bhet Punaha Gatalepana Sekamstu Shitaneva Sekarayata. In case of Durdagda, where the burn is deeper, then it has to be both Shita Kriya and Ushna Kriya, and you have to, but application would be always the Shita Dravyas as such. Now, Samyak Dante, if it is still deeper burn, then Tugakshiri Plaksha Chandana Gerike is Amate Sarpisha Snigdehi Alepam Kare Bishaka. A Alepa is advised, and it could be of Alepa with the substance in Tugakshiri Plaksha, etc. Now, which will produce a partially permeable membrane and will reduce the possibility of the fluid loss. Even in the current situation, in case of extensive burn, one of the alternative choices to reduce the fluid loss could be either a plasmid membrane, a membrane, colloid membrane which can reduce the fluid loss, or a skin graft. A skin can be replaced so that the fluid loss is reduced. Now, that kind of a membrane can be formed by Gramya Anupa Udakam Pisteihi Mamseihi Pralepet. A flesh of the animals is pound finely and grinded finely, and then it's applied over the surface. This will produce a water, rather partially permeable membrane, which can result in a lesser fluid loss. So, Shita Kriya as well as a method of prevention of fluid loss in case of a deeper burn is suggested by Sushra. And then the further management will be Pitta Vidrati Vachinam Santata Pushpanam Achareta. All the management principles of Pitta Vidrati have to be followed as in case of the deeper burn. In Atidagdha, when the burn is still deeper and there is a tissue destruction, dead tissue is there, then there is a need for debridement, and that debridement has to be Atidagdhe Vishenani Mamsani Uddhite Shitalam Kriyam Kurya Bishek Paschat Shant Andula Kandanihi Tindaki Pak Kapalirva Ghisalistreh Plarpet Pranam Guruji Patreva Chadayat Adava Udakai Kriyam Tenikilam Kurya Bishek Pitta Visarpota. In case of Atidagdha, again the treatment has to be a debridement, that dead tissue has to be removed, and you'll have to create a fresh healing tissue. Then the next protocol is same lepana as well as patradana, use of leaves over the area, again to reduce the fluid loss. Further on, it has to be treatment as the pitta visarpa, like the visarpa as such. मधुष्टम समुदकम रोधम सज्जरसं तदा मंजिष्टां चंदनं मूर्वां पिष्ट्वा सर्पैर्विपाचयेत सर्वेषां अग्निदग्धानाम् एतद् रोपणोत्तमम्. A general combination of a Ghrida yoga for the treatment of burn is where madhu chista, madhuka, ravodha, sarjarasa are added, and you will have to prepare that. In Snehadagdhe Kriyam Ruksham Visheshena Amacharayet, if it is a humid heat, then the Rukshana Kriya has to be done. So all that humidity has to be removed, that fluid content has to be removed. That's about the management of accidental burn. Now, the next complication related to the burn would be Dhumopahata, or asphyxiation due to the smoke, or suffocating due to the smoke. Atavurdhvam pravakshami dhumopahata lakshanam श्वसिति क्षौति च अत्यर्थम अत्याधमति काचते चक्षुषोः परिदाश्च रागश्चैव उपजायते सधूमकं निश्वसिति घ्रेयम् अन्यन्यवेत्ति च तथैव च रसान् सर्वान् श्रुतिश्च अस्य उपहन्यते तस्माद् दाहज्वरयुतः शीतत्यतत्य मूर्च्छति धूमपह इत्येष शृणुतस्य चिकित्सितम्. It's true, absolutely true, that in any of the fire accident, whenever there is a mortality, the casualty as such, majority of the casualty is due to the suffocation of the smoke than really the burn by the fire. See, whenever there is a mass casualty produced due to a fire accident, if you take a statistics, in majority of the situations, almost in all the situations, the number of casualties produced due to the suffocation of the smoke is more than the number of casualties produced due to the direct heat or the flame as such. And hence, the management of this suffocation patient is quite important. And the clinical signs of that suffocation, according to Sushruta, is the patient would have a breathlessness, shositi, or even may have a sneezing if there is due to the irritation. And the patient may have a deep breathing, atyartham adnapeti, adhamati, kasade, cough. That's all the signs of irritation of the respiratory tract. Or it could be burning sensation over the eyes or throughout the body. The body also may become reddish in color due to the hyperemic changes, and the patient may have a impaired smell sensation, graham anyannavetita, or even he may not be able to sense the taste as such, or even he may not be able to hear. That means he will have an impaired level of consciousness. Systemic symptoms of hyperpyrexia, Trishna, Dvaha, Daha, Jvara, or patient may become totally unconscious. These are the possible clinical signs of the smoke inhalation or suffocation. Now, smoke inhalation from the clinical point of view in the present situation is one of the major issue in case of the fire accident, and another trouble of the smoke inhalation is at the time of the injury, the clinical signs may be lesser. The majority of the complications occur after a certain period of lag time. Like patient may look normal at the area where you have seen the patient, but the patient may develop the complications of the airway obstruction or lung edema in due course of time. And the sequence of complications could be the smoke when it is inhaled, it produces a irritation of the lung alveolar tissue, and this inflammation would be gradually progressive. Even after the smoke has gone or rather reduced, there is a possibility that the inflammation may continue and it may result in collapse of the alveoli, and hence whether the patient has a clinical sign or not, the current approach is patient is given a oxygen and a mechanical ventilation temporarily, so that the chance of collapse of the alveoli can be lesser. So if there is a patient with the smoke suffocation, even if there are no pulmonary signs at that moment, administration of the oxygen with a relatively positive pressure to keep that alveoli dilated is one of the essential protocols, and so that the later complications can be minimized. And once there is a lung edema, the management will be difficult. Now, the management of this smoke inhalation according to Sushruta is Sarpihi Ikshurasam Draksham Payova Sharkaram Va Madhuramlo Raso Vapi Vamana Prarapayat. Vamana is considered to be one of the steps by Sushruta for the management. Of course, practically, whether a Vamana can be given in a patient with the suffocation and compared to the current protocol of administering oxygen, how far it will be useful, I don't have a direct experience, so that needs to be tried. But and of course, if a patient is in a very critical condition, like where the patient's oxygen concentration is lesser, it may not be possible. So that indication for the Vamana has to be more selective. Only in a fit patient, Vamana may be given. Vamata Koshishuddhisyato, Dhumagandashana Shati, Vijananena Shamyanti, Sadana Kshavajujvaraha, Dahamukcha Tadatmana Shwasakasashidarunaha, Madhurehi, Lavanamnesha, Katukehi, Kavalagrehi. After the Vamana, according to Sushruta, Vamana would be facilitating the Kosha Shuddhi, and after the Vamana, the patient is given Madhura, Ravana, and Katukadravi for Kavalagraha. He has to have the Kavalagraha. Samyak Granati Indriyarthan Manashasya Prasidati, Shiro Virecharam Tasme, Dadyad Yogyana Shastravita. With the Kavalagraha, the patient would have a relief of the symptoms, and he will be able to have a normal consciousness. Then Shiro Vilachana is given. Shiro Vilachana is given with the any of the Nasya Yogas. Drishtihi Vishuddhyadetasya Shiro Grivantadehinaha. The Shiro Vilachana helps in clearing the vision as such, and later the patient is given a ahara which is avidahi lakhu snigdham aharam chasya kalpayat. Food should be easily digestible and should be nourishing. Ushna Adatape that they Shita Karya Vihitsada. Now, Sushruta has identified the complication of the heat exhaustion. That heat exhaustion is where the patient is exposed to the bright sunlight, heat acid, and due to the heat, the patient would have heat stroke. Now, in the heat exhaustion and heat stroke, these are the two important clinical conditions, Ushna and Sushruta has suggested the Shita Vidhi, but with the current knowledge, we should make out the difference between a heat exhaustion and heat stroke. In heat exhaustion, which is more common than the heat stroke, the heat exhaustion patient may have a fainting, dizziness, looks pale, and there could be nausea and vomiting, but the muscle cramps as such, but patient still remains conscious. In such conditions, replacement of the fluid and cooling the body would be keeping the patient in a relatively cool environment would be enough. But if the patient has a heat stroke where there is lesser sweating, the sweating has become reduced, and the patient loses unconsciousness, that's a clinical emergency, and the patient has to be treated immediately with IV fluids. That's all the important issue. The general approach to the management of heat exhaustion is simple. You make the patient lay down, use a fan, apply some cold compressions. Whereas in heat stroke, it has to be, you have to have the reduce the core management temperature of the body has to be reduced. To reduce the core temperature, you may use ice pack or maybe lavages, water sprays. You have lots of technical these instruments which are used. But most serious would be, there is always a risk of the organ dysfunction, blood clotting, disseminated intravascular coagulation can occur, and it can result in a permanent CNS dysfunction, or even fatal complications do occur due to the heat stroke. And management of the heat stroke is an emergency. It has to be done by hemodilution. You'll have to give this larger amount of fluids, and antithrombins also have to be given. Now, another is comparatively is Shitavarshani Date Studam Usnam Chashasire. The injury to the tissue due to heat and the extreme cold are similar. There will be coagulation of the tissue and there can be necrosis. This is what we call as a frostbite. Sushruta has identified them also as the frostbite. In the present day situation, the injury to the cold is categorized into two categories: trench foot and frostbite. Trench foot is where the tissue, the damage is still reversible. Frostbite is where the damage is irreversible. So in a frostbite, it needs to have the amputation. In a trench foot, the rule is do not warm immediately. You just cover the area. If you warm the area, there is a possibility that there could be necrosis of the tissue because the sensations will be affected. Then another of the similar issue is the lightning or electrical strokes. In Sushita's time, there was no electricity, but lightning was common. Now you have electricity also, which has a very similar issue. Tata atitejasaragde siddhir nastikadancana indra vajragni devi jivati pratikarayet snehambhyanga parishekeh pradeheshya tadabhishaka. The lightning or the natural electricity producing the burns, we can have unpredictable complications, and hence Sushruta says the prognosis is unpredictable. If the patient is living, then you will have to manage the patient with the sneha, abhyanga, parisheka, pradeha, etc. Now, from the current point of view, any lightning as well as electrical injuries, they are of two categories. One is the local, where you will have a burn at the point of exit and entry of current, and then there the management will be of that of the burn wound. Whereas the most significant would be the cardiac effect. As the current passes through the body, it can produce complications of the heart. Either there could be a sudden cardiac arrest or myocardial ischemia could be precipitated, and this has to be managed and that has to be assessed. Then with this we conclude. Iti Sushrutamitaam Sutrasthane Agnikarma Vished Nama Dvadashodhyayah. Summary: Agnikarma was and is popular in all systems of medicine. Selection of the tools for cautery is based on scientific principles of heat capacity. Use of thermal energy in surgery has contributed significantly in enhancing the scope and the reach of the surgery. That's quite important in the current idea of endoscopic surgery. That harmonic bipolar tools are the major issues which have facilitated that laparoscopic surgery or all endoscopic surgery are possible only because of these tools, and hence they are the major contributors to that kind of a technology. Then Ayurvedic perception of Agnikarma has a wider scope than the current perception, like inducing fibrosis or a systemic effect of the Agnikarma. With this, we'll conclude. If there are any questions, I'll try to answer, and then right, there are no questions. Okay, thank you. There is question. As in Chikitsa Sutra or Sushruta, Agnikarma is also there. It means we have to go with Agnikarma only initial line of treatment, or if not managed with any other treatment, should we go? I think this question is a bit ambiguous question. Agnikarma has a specific indication, and according to Sushruta, Agnikarma has to be prescribed or used when the other options are not, or options have failed, like. So Agnikarma is considered as ultimate, but it's not the question of the Agnikarma as a first line of treatment or the other way. Indications for the Agnikarma are very specific. So when we should keep agnikarma as the first line of treatment or last line of treatment, as in practice, of course, it's absolutely true that agnikarma can be used as a first line of treatment in certain specific conditions like warts and so on, where the tissue damage is relatively lesser, whereas in the other conditions it could be last line. And when we use the agnikarma in the present day situation, it's better to have the current tools like the cautery, the electrical cautery, then depend upon what Susu has mentioned. The same tools may not be practicable, whereas because we have more sophisticated tools where the heat can be controlled better, so that's a better option. I think, right. So with that, there are no more questions. We'll stop it then. Okay.
Thank you, sir.